Good evening, Professor. Thanks so much for your time. I'm sure you saw the Gauteng COVID update. It's looking really good. It does really look like Gauteng, which is the epicenter with over, I think, 37% of active cases, still the focus, still the epicenter of the virus. But we look like we're on the right side of that curve now. Would you agree?
Yes, in fact, I was quite excited to see the NICD report this evening. I'm sure you've seen it as well, about the reproductive number, the effective reproductive number. And then if you look up to the end of August, in fact, it was about 1 or below 1. So transmissions have really decreased. So yes, we are certainly optimistic about what we're certainly observing. However, I think as you've mentioned, I mean, it's not as if we're out of the woods. There are still cases in Gauteng and, in fact, all the other provinces as well as deaths. So I think we still need to ensure that we adhere. In fact, it's encouraging if we've been below 1 that we continue to do that. And in fact, it means that those non-pharmaceutical interventions need to be in place, and we need to encourage people to continue to give that. I know it's summer. We'd like to be out there throwing our masks up in the air, but I'm afraid they need to be put on properly.
And I want to just read something to you. Admittedly, these are fairly anecdotal reports, but a number of doctors in Gauteng are saying that they're seeing a spike in their patients coming in through the door, in COVID patients. I know that Talk Radio 702 spoke to Dr. Karen van der Merwe. She said a group of some 200 doctors are reporting a surge in cases in Gauteng since level 2. Also, there's a very interesting Facebook post from Bedford View Doctor, and I'll read a part of it. It says, "We had not documented a single positive case of COVID-19 in the past 3 weeks. This all changed last Friday. We've confirmed 10 new cases since then. 5 had contact with each other. The other 5 were all single individuals in the Bedford View area. The point is, as we go to level 1, do not think this awful illness is on its way out." How worried are you about these anecdotal cases? Obviously not enough to move the needle on where we are with infections. Could this just be a little bump that we all expected in the numbers as we ease restrictions, or a worrying sign that things could spike really fast?
No, these are the important alerts. Admittedly, I have not seen the official reports from NICD to document that, but you're quite right. I think the President also announced a very important fact, is that we are not doing the testing or the testing levels that we should be doing. And so I think that's really critical for us to increase our testing capacity again, to really get a good sense about what is actually happening, because that's really going to be critical for us to manage the next few months. Because, as you've already said, we've seen what has happened where the risk adjustments have occurred in the UK, the United States and Europe, that as you've opened up your society, greater movement, larger numbers of people come into contact with each other, the more likelihood there are going to be super spreader events and infections occurring. And also remember, asymptomatic spread is one of the major routes for spreading. And so it's really critical that we keep a good handle on where we are with this particular epidemic at this particular phase, in order for us to make those decisions about, how do we manage the risks? Do we go back to level 2, or what combination do we have in order for us to still continue and open our society, but at the same time also, because we're still seeing deaths, that means there are vulnerable people out there. How do we protect and shield those particular individuals?
And it's important to remember as well that the President said that under level 1, we can now go and get a test if we've been exposed to someone, even if we don't have symptoms. And as you said, that asymptomatic spread could be really, really dangerous.
Absolutely. It's really important that we get our testing levels up, because asymptomatic spread is really a critical component. Perhaps we also need to rethink our strategy around what type of test or testing we should be using. For example, I know that in the United States and other countries, they've been talking about the so-called antigen tests. These are more rapid tests, which should be cheaper than the PCR. But if they perform well, they may be less sensitive. But if they perform well, this may be another way in which we can expand our testing to really get a good sense about what's happening in our communities.
Yes, because I understand the antigen test, while it's done the same way as the PCR test, is a lot cheaper, and of course the antibody test is available now as well, which is all really very useful. Do you think that we're going to perhaps avoid a spike as we're seeing in the UK, because we're going into summer, they're going into winter, and while I do see a lot of young people on my drive home through Parkhurst hanging out without their mask because they're so-called at a pub, not really that far apart, we're all outside at the moment. We're heading into our summer. We know that the virus dies really quickly in sunlight. Do you think we might avoid the worst for that reason alone?
I don't think so. I think we still need to come back to those key non-pharmaceutical interventions. I know being on the outside, our risks are less. However, many of us are in workplaces, in closed, confined spaces. And we have, workplaces where the policies need to be in place to ensure that we are protected. So in other words, ventilation is going to be a really critical part. We're still traveling in large numbers and in close contact with each other. So I think those risks are still there, I'm afraid. So I think however much we like to think that we're out in the open, there are still those individuals that are in close contact where we need to have clear policies around that. In fact, it's very interesting. When you read the Gazette, it says that you need a compliance officer to make sure that, for example, bars, restaurants are actually compliant. And in fact, you should have a notice about how many people should be in that particular area in terms of ensuring that it's, the social distancing, physical distancing is actually being applied.
I think a lot of the anecdote... Sorry, yes.
It says that you have to inform people that you're not allowed to enter without a mask, for example. So these things, it's about compliance. It's about encouraging people to be compliant. And unfortunately, there may be some enforcement regulations in place as well.
A very quick one. I know that next week we are due to open up our borders from the 1st of October. We've heard tonight that Airlines Emirates has been cleared to fly in. Any idea how soon that list is going to be out? Our indicators are looking good. As you say, our reproductive rate is below 1, which is where we want to be. We look like the curve is dropping. Do you think that we're going to have an extensive list? Do you have any preview of what's going to be on that list?
I don't really have a preview, but I suspect that there's probably going to be lots of debate and lobbying, I suspect. Because I think if you look at the UK or the United States, for example, I mean, these are what I would deem as higher risk countries compared to South Africa. So again, are they going to be on that list, or who's going to be on that list? And I believe it's going to be announced, I think, on the 1st of October when that list will come out. So it'd be very interesting to see if there's going to be a risk adjustment approach there, who really is going to be on that list.
Absolutely. Well, thank you so much for your time this evening, Professor Adrian Purin, Head of the Centre of HIV and STIs at the National Institute of Communicable Diseases.